Edible nanoencapsulation vehicles for oral delivery of cannabinoids. Understand the physical and chemical properties of cannabis, bioavailability in different modes of administration, nanotechnology for enhancing the drug delivery system, and bioavailability. Doctor of Philosophy and Chemistry, Chulabhorn International College of Medicine, Thammasat University. From Thailand, Assistant Professor, Dr. Burapol Singhana.
Good afternoon, the audience. And I would like to say thank you, the organizer, to invite me to give talk today. Today, I'm going to talk about edible nanoencapsulation vehicles for oral delivery of cannabinoids. So the topic is going to be about how to use nanotechnology integrated with cannabis to enhance bioavailability. Right, for this one. So, but before I give you more detail about my talk, I would like to introduce myself first. My name is Burapol Singhana. I'm from Chulabhorn International College of Medicine, right? Thammasat University, Rangsit campus, right? For this one. So I would like to give you a basic thing about cannabis first. There are 3 species: Sandiwa, indica, and this one, right? This one, we found cannabinoids a lot in this species, right? So in the past, they used for what? To make coating, to make a coat, get the fiber from the tree, and we use for heal the patient in medical application and use as ingredient in food and cosmetic for this one, right? So the important thing you see, the white one like this, like a wax, right? So it called trichomes. This one gonna have a lot of THC and CBD or another cannabinoids compound for this one. So when we look at the phytochemicals in cannabis, right, we found or we can isolate 545 compounds, right? So, and consisting of 441 non-cannabinoids, which is terpenoids, flavonoids, lactic acid, or alkaloid. And there are only 104 cannabinoids compound. The distinguished compound are THC, or delta-9 THC, and CBD, right, for this one. But in the fresh cannabis, you're gonna see THC-A, right? Not THC. THC-A is has carboxylic acid here. It's gonna be non-psychoactive effect for this one, or non-psychoactive compound. But when you heat it up at 150 degrees Celsius, right? When you smoke it, this compound gonna decompose to get psychoactive effect. You're going to feel high, right, for this one. So this cannabinoids compound, the distinguished one, THC, CBD, and another derivative, right, for this one is terpenoid compound for this one. And another terpenoids, for example, these essential oils, right, we found in cannabis, right, make your cannabis feel good, smell good, right, for this one because of this essential oil, right? So we found this essential oil in this plant also. For example, this one we found in lemon, right, for this one, or this compound we found in lavender, right? They are essential oil, right, for this one. So I want to give you a little bit about biological effect. For example, THC, right? When you heat it up, THCA, you're going to get THC, right? For this one, show potent psychoactive effect. You're going to feel high. It shows pain relief, appetite stimulation, brain health, antioxidant, anti-nausea, anti-spasmodic property, right? They use this one for when you get chemo, right? When the patient get chemo, you have to take this drug to decrease pain or anti-nausea for this one. Another one, CBD, right? show low psychoactive effect, show anti-inflammatory effect, mood enhancement, pain relief, and decrease appetite. If you want to be leaner, you have to take CBD for this one. And another derivative, CBC, CBG, show the same trend as CBD, right, for this one. So this one is really important thing. For myself, when I want to cook something, I have to understand the molecule of that thing very well. If I understand it well, I can control everything. The same thing as here, right? So the physical chemical property of THC and CBD. Look at here, right? Log P. Log P tell you what? If log P value is more than 1, that means they love lipid. That means they're gonna love what? Dissolve in oil. Oil is non-polar. But if log P less than 1, they're gonna love what? Water. They dissolve in water. They are gonna be what? More polar or polar, right? For this one. So look at THC, show higher log P and show lower water solubility. The same thing as THCOH, THC carboxylic acid, right? Show higher log P and show lower water solubility. That means they cannot dissolve in water, right? For this one, a little bit can dissolve in water. How about CBD and CBC and CBG? Show the same thing, right? Give higher log P value, and they show very low water solubility. That means if you want to mix water, if you want to cook your food with water plus cannabis, your cannabinoids cannot dissolve. Or if you want to say what recreational drink, right? Having THC or CBD as an ingredient, they cannot dissolve in water. They gonna have less THC. That means they're gonna have less effect, right? For this one, this is the problem when you want to make like use this compound for medical application, or if you want to use it like make soft drink or recreational drink or make some food, right? Because they cannot dissolve well in water. And another thing, this compound is not stable. When you want to sell it, you isolate this cannabis oil and you keep it for a while. THC going to be decomposed, right? For this one, they form oxidative reaction. They convert from THC to be CBN. Right now, you lost what? Psychoactive property. You not feel high at all because they convert to another compound. And this compound form what? Can form isomerization, right? To get this product, delta X, right? Theta hydrocannabinoids for this one. So based on this one, we found two things right now. The first thing, cannabinoids show very low water solubility. It's gonna be like an obstacle for what used in like in food, right, or medical application. And the second one, cannabis not stable for this one. So look at here, mode of administration, how to take it, right? So I want to like besides we're gonna use cannabis for heal the patient. It is possible or not if you want to like make or cook CBD or THC product, and so in the market, right? For this one, that means I want to make like a soft drink with CBD, THC, right? For example, so if you want to make that, right, that means you have to eat or you have to drink. Look at mode of administration, oral route, right? This step, right, show low absorption, and it kind of vary, right, for this one. And the important bioavailability is really low, super low. Some paper reported it's just like 6%, but this one is less than 15%, right, for this one. And when you eat these phytochemicals or these cannabinoids, going to face the first pass metabolism. They cannot stay in our body. You eat and then you excrete from the body immediately for this one. Another step, another route we call rectal right, route for this one by using suppository, right? It shows good absorption, and its bioavailability is much better than the first one, and this step can avoid the first pass metabolism. But compared with the first route, oral route, this one gonna be a little bit like a complicated, right? The first one gonna be easier. If you want to make the product, it's gonna be easier to be like used, right, for this one. So if you want to inject into your body via blood circulation system, right, this one show very low water solubility, right? Because CBD, THC show very low water solubility. If you want to inject CBD, THC into your body, you have or you need to do what? Require special formulation for this one. And it shows rapid onset of action, and those limitation effect, short duration of effects for this one. And the popular route is smoking or inhalation for this one. This one shows rapid absorption, like an IV, right? When you smoke, you form GSCA to be like GSC, right? Your body can absorb really fast. And show higher bioavailability, 18 to 50%, depending on what kind of smoking technique for this one. And the last one, we rarely use topical, like it's going to be very limited applicability for this one. So pharmacokinetics profile of cannabinoids, right? The first thing, if you look at here, you're going to see Cmax and Tmax. Cmax, that means the height or maximum concentration of cannabinoids in the blood, right, for this one. So when you reach at this point, right, how long you're going to reach at this position, we call Tmax, right, for this one. And area under curve or AUC here, we can calculate or we can determine, right? Based on this one, you can find out bioavailability, right, for this one. And another one I want to introduce you to know about it, bioaccessibility. Why is it? Bioaccessibility is the fraction of the bioactive substance or cannabinoids, right, present within the gastrointestinal fluid, right, in a physical state, capable of being absorbed by the body, right? How much you have this compound in what? Gastrointestinal fluid, which is aqueous system, right? So if you have not much, that means you can have low bioaccessibility. If you have a lot of compound here presented with gastrointestinal fluid, for example, enzyme, you're going to have higher bioaccessibility, and you have higher chance to have what? Higher bioavailability for this one. And the last one, bioefficacy, is the minimum dose required for phytochemicals or cannabinoids to what? Exert bioeffect in vivo for this one. So factors affecting the overall bioavailability of cannabinoids. So you can calculate from this one effective dose, right? That means dose time what? Bioavailability. How much you eat and what is the value of bioavailability, and then you can know what effective dose. For example, if you take 10 grams, it doesn't mean you're gonna use whole 10 grams, right? You might use only, your body can absorb only 1 gram. For example, you can have low bioavailability for this one. When you want to see effective dose, you can find out or determine from dose time bioavailability, right? So this factor, right, affect to bioavailability. That means your bioavailability or bioavailability of cannabinoids depend on this factor. The first one, bioaccessibility, right, for this one. Release of cannabinoids from food and solubilization in GIT fluid, right? How much, right, show up mixing with GIT fluid. And the second step, absorption, transportation of cannabinoids through mucous layer and uptake by epithelial cells. And the last one, biodistribution or distribution, right? And another factor, metabolism and excretion for this one. This factor affect to bioavailability, right? If your cannabinoids cannot dissolve in water, that means you're gonna have less what? Less bioaccessibility, right, for this one. Here, right? So if I want to show you like how about another problem with another phytochemicals in medicine, right? So even though we have good activity, some plant, some herbs show excellent bioactivity, right? But you have to eat it like a fresh. But when you want to isolate, we want to like get the pure compound and use that pure compound in a clean it doesn't work. What's the problem? The problems like the first one, they show low absorption. They are organic compound. They are kind of lipophilic compound, right? They show low bioavailability. And the second one, they show low hydrophilicity, doesn't like water. And intrinsic dissolution rate, right? The physical and chemical instability. Some compound in the fresh plant is work, but when you isolate, right, it decomposes. It's not stable. It cannot stay with like air in the light, in the oxygen. They form an oxidation reaction. For example, they have like a scar biodistribution. They first pass metabolism and poor penetration and accumulation in the organs of the body. For this one. So there are many approaches or many strategies to enhance bioavailability or to deliver drug, right? But how to use nanotechnology for drug delivery system? The good thing, why we can figure out like the problem, as I mentioned before. The first thing, nanotechnology can enhance or improve delivery of poor water soluble drug, right? That means we increasing solubility. And second one, nanotechnology strategy can enhance what? Photo and chemical stability. We can protect phytochemicals, right, for this one. Bioavailability, and as a consequence, we can enhance efficacy. We can make it more smarter by what? Connecting with targeting ligand, right, to be targeted delivery of drug in cell or tissue specific manner, right, in order to decrease side effect. For example, doxil or lipodox, right? We put doxorubicin into liposome, we can decrease side effect, right, for this one. And another one, transcytosis of drug across the tight epithelial and endothelial barrier, right? Deliver of the large macromolecule drug or biological drug, for example, protein or antibodies, right, for this one, to intracellular site of action. We can do like put more drug to be like synergistic effect, right, for this one. And we can visualize the site of the drug delivery by combining therapeutic agent with imaging modality. For example, we add with magnetic nanoparticle for MRI imaging, for example, right? And we can monitor or real-time read on the in vivo efficacy of a therapeutic agent, right? We can monitor this one, it's real-time. And we can mask and present test. If it's bitter, we can make with some polysaccharide to make it less bitter for this one, right? Or limit the volatility of a molecule or extract. For example, we want to make like a essential oil stay longer, right? When you apply your essential oil, you can make it like can stay for a whole day instead of it's going to be 1 hour and it's going to be volatile, right, for this one. So this is the nanoparticle for the delivery system so far, right? Here, nanoparticle. You can make from inorganic and organic. You can make from polymer. You can make from silica or polysilicon nanoparticle, right? You can pick depending on your application. And the important thing, you can control the size. Different size have different property, right? Depend on your application for this one. You can make small size and larger size. And then after that, you can control or you can prepare nanoparticle in many shapes. For example, to be sphere, cube, rod, plate, or star, right? For this one, and then after that, you can what? Functionalize surface, right? Here, right? To make it more smarter, to be still nanoparticle, you coating with PEG, or you can make this like polar or non-polar here. You can add with functional group here, right? Or you can what? Make to be positive or negative charge, and then you can form bioconjugation reaction with antibody or peptide or aptamer to be like a bind to like a to the target specifically for this one. So how about nanoencapsulation vehicles for oral delivery of cannabis, right? So as I said right here, nanoparticle, you can pick what kind of material you're going to use for making this one. But for innovative things, for something you can eat, you have to pick what? GRAS ingredient. That means it's going to be what? It's safe, right, for this one. That means you can pick like many lipids, for example, sunflower oil, right? Polysaccharide protein, biodegradable polymer, for example, PLGA, PLA, as a building block to make this one. And then you can what? Engineer. Or you can like do like a rational design of ENV here, right? You control the size, right? To make it suitable for your application or suitable for your product. Usually, if you want to make with water, you have to make less than 50 nanoparticles. They can stay longer in your drink for this one. Or surface property, metric materials, and complement structure. For metric materials, right? The smart thing, I can control my particle to release cannabis at small intestine or large intestine, right? We can adjust that for this one. It is a good thing, right? To what? To enhance bioavailability of cannabis or cannabinoids for this one. So when we do that, right? Innovative nanoparticle or nanoencapsulation vehicles affect the bioefficacy of cannabinoids by what? Influencing the disposition and gastrointestinal GI stability. And they're gonna be like influence the state, the rate and the size of release. We can control that, right? Influence the transportation efficacy across the endothelial layer and systemic circulation and biodistribution. And last one, they can control or influence the regulation of microflora metabolism process, right, for this one. Here, so far, I want to show this one. We working with cannabinoids, but the problem for cannabinoids, they poor water solubility. They cannot dissolve in water. If you want to make like a soft drink, right, for this one or food, something like that. And after that, they show low bioavailability and their structure not stable at all. The compound cannabinoids are unstable for this one, right? So we use nanotechnology to figure out this problem. And this nanotechnology make from what? Something you can eat. We call eatable nanoparticle, right? And then when you make this one, what happens? You get this benefit. You get higher bioavailability. Your cannabinoids can dissolve in water, and you can control what? The site to release the drug, right? You can control release, right? And then you can get higher loading capacity. You can protect your cannabinoids to make it stay longer, enhance stability, right? And this compound is going to be compatible with our body and is a food grade. But when you make this one, you have to what? Take care of this factor. You have to determine percent EE, percent loading capacity. You have to control the size. You have to control your system to be monodisport, right, for this one. And you have to control this thing, right? Morphology, stability, release profiling, and toxicity before you sell your product for this one. Here is some common type of eatable nanoencapsulation vehicle, right? Most make from lipid or lipid, right? For example, microemulsion and emulsion, both nanoemulsion and conventional emulsion for this one. And liposome, solid lipid, nanoparticle, and film microshell, right? This system have been used in like encapsulating cannabinoids and mix with water to make soft drink or CBD drink, or mix with to make a cookie or something like that, right? For this one. So I want to show you some system. For example, microemulsion, right? For microemulsion, why is it? Microemulsion is a cell assembly surfactant-based particle with a hydrophobic, that means doesn't like water, core and hydrophilic shell. The size going to be 5 to 100 nanometers for this one. The good thing for this one is really easy to make. It can happen by itself, right? It's thermodynamic stable, easy to fabricate, good stability, and it's sure transparent, it's clear, and rapid release. But the bad thing, to make microemulsion, you require high synthetic surfactant level, which is not good, right? Because if you want to make like something you can eat, you have to make like a food grade, right? Or natural surfactant for this one. And low loading capacity, and you face test and toxicity issue for this one. And emulsion is my research or my thing here, right? Emulsion is lipid-based particle consisting of a liquid hydrophobic core coating with an emulsifier shell to stabilize your nanoemulsion, right? For this one, the size can start from 100 to 100 nanometer to 100 micron, right? For this one, basically, if the size less than 500 nanometer, it's going to be nanoemulsion. But if the size larger than 500 nanometer, we're going to call conventional emulsion for this one, right? So this one easy, very easy to fabricate, right? Can be produced on a large scale, right? For this one, and it from clear to opaque, high loading, and we can use like biomaterial as building blocks for this one. But the bad thing is it's not stable for this one, right? It is thermodynamically unstable, susceptible to what? From aggregation and creamy, right? For this one. Solid lipid nanoparticle, it is the same as emulsion, but the core going to be solid lipid instead of it's going to be liquid, right? For this one. And liposome is a common one having used in like a pharmaceuticals or in many applications, right? For this one, liposome make from phospholipid-based particle with a hydrophilic watery core surrounded by hydrophobic shell, right? Inside going to be love water, outside going to be what? Coated with not love water, love lipid, right? For this one. The size going to be like a 50 nanometer to 50 micron, right? For this one. The good thing for liposome, they can load both hydrophobic and hydrophilic molecules, right? In one system for this one. But the bad thing for this system is poor stability in many commercial products, right? And importing the building block is so expensive. Phospholipid is expensive for this one. There is a system having used in making like a edible nanoencapsulation vehicle or edible nano carrier to what? Deliver cannabinoids for this one. There is a system, I want to show you a little bit about this one, right? When you form lipid-based nanoemulsion or what edible nanoencapsulation vehicle here, right? You put drug inside here, right, for this one. And then when you eat it, right, it's go to what? Intestine, small intestine, right, for this one. At here, there is a pancreatic lipase going to digest your particle. They're going to digest what? Lipid, right? And then they form a diglyceride, monoglyceride, and free fatty acid. After that, they're going to itself to form mixed micelle again. At this step, they're going to be about encapsulate the drug, and the drug going to take into what? Epithelial cell. At here, they're going to form what? Cytomicrons, and then transport to lymphatic system, and then they what? Bioactive distribution to another organs for this one. This is how to use lipid-based nanoemulsion or nanoparticle for what? Delivery phytochemical. It's conformed like this, right? We know very well about this behavior in our body, right? Here you can what? Based on this one, you can design your particle, right? For this one, what kind of lipid you're going to use for making eatable nano carrier, right? For this one, you can use digestible or indigestible depending on your application, right? For this one, and you have to take care concern about chain length. If you use short chain length lipid, they're going to give you like low percent EE or low percent loading capacity. But if you use longer chain, you can get higher percent EE, right? For this one, and saturation or how many double bond and physical state, right? And you can turn the size depending on your application, and you have to pick what emulsifier to stabilize your particle, right? For this one. And another thing, you can add another additive, right, to your system, right? For example, pH enhancer to enhance penetration, or you can add efflux inhibitors, right, to stop P-glycoprotein, to stop efflux effect here, and drug going to go into the cell more. It's going to enhance bioavailability. And you can add another things, for example, texture modifier or antioxidant to what? To stop free radical reaction in your system, right? To make your particle or your nano emulsion stay longer for this one. Here, I show you like how to keep your THC stay longer, right? Here they encapsulate THC in liposome or phospholipid to form two layer, and then they add another additive, that means antioxidant, right? When you put keep this one in storage, right, for like a longer time, like 180 days, right, your THC decrease a little bit, not much. That means you have more THC in your product. But if you do not add antioxidants, your THC concentration decreased a little bit, right, for this one. But if you add like just emulsion for this system, they say that this system emulsion with antioxidant, they're going to decrease a little bit fast. But if you do not add nano particle or liposome or something like that, and you just make water with THC, THC going to be decomposed really fast for this one, right? Just 30 days, you get zero. That means if you mix THC with water and then you put in the market 7-Eleven, just 1 month, you have to get it off from the shelf because there is no THC activity anymore for this one. And here, they show how to use nano emulsion to enhance bioavailability. They make nano emulsion based on this system. They use vitamin D as oil phase, and then they mix with ethanol as co-solvent and use twin 20 as surfactant. They make particle, and then they feed the rat, right, via oral route. They found that the percent bioavailability increased because they found the concentration of CBD in the blood is higher. CBD in nano emulsion is higher than CBD oil. That's it. I show you how to use like a nano encapsulation vehicle to enhance bioavailability. That means we use this technology or this innovation to enhance to add the value of cannabis product. Thank you so much for your attention.